of 834 cases daily since the beginning of July 2020, while Umgungundlovu district has been receiving 292 cases daily since the beginning of July of this year. King Cetshwayo district is now the third highest, and they have overtaken Ilembe, and they've been reporting an average of 126 new cases. So it will range from 49 to 266 since the beginning of the month. The district is also the third highest in death toll provincially. Amajuba district has been receiving a maiden number of 862 cases, and that is a lot from July, from the period of the beginning of July. In terms of the cases provincially, eThekwini, this week alone, we had 1,796 new cases. And the total now of cases in eThekwini is 30,074. Deaths are at 345. Ilembe, new cases 104. The total cases is 2,637. Deaths are 19. Umgungundlovu, 312. And the total case, that's the new cases for the week, and the total cases is 915, and deaths are at 85. Altogether, it's 143 new cases within a week, and the total number of cases is 2,804, and deaths are 30. In King Cetshwayo, total number of new cases is 251 in the week leading to yesterday. And the total number of infections stand at 4,188. Deaths are 50 now. Ugu, 204 new cases in a week. And the total number of all cases, positive cases, is 2,424. Deaths are 15. Amajuba is 258. The total number is 3,110, and the deaths stands at 19. Mkanyakute, the new cases within a week is 45, and the total number of all cases is 687, and there has been 10 deaths. In Herikwala, the new cases in a week is 66. The total number of cases stand at 1,390, and deaths are 17. Zululand, 106 new cases in a week, and the total number of all cases is 2,095, with 16 people who have died because of this pandemic. Umzinyathi, 88 new cases for a week, and 1,299. It's a total number of cases and 8 deaths. There is not even a single district that has not experienced a death-related case now. And that tells you that the spread is all over. The impact is in each and every district. We give a breakdown in terms of incidents per 100,000 population. We are going to provide that with a statement. The laboratory status in KwaZulu-Natal, although KwaZulu-Natal is currently the 4th highest ranking province with the number of laboratory confirmed cases, the province ranks as the 3rd highest in terms of laboratory testing. So it means we continue to test more people. The overall proportion of positive cases for the province was at 13.3% and it is the 7th highest nationally. We'll provide a breakdown also. As on the 25th of July 2020, the province has had 1,822 patients admitted in both private and public hospitals, with 78% in private and 22% in public hospitals. Of those admitted, 274 patients required intensive care services. Among those who required intensive care, 57% were ventilated. Other patients were admitted in high care in both private and public facilities. We take time to reflect on Inkosi Albert Luthuli. Inkosi Albert Luthuli Hospital had 49% of patients admitted in intensive care unit, followed by Grace. Of those admitted in ICU, 81% were ventilated. More than half of the ventilated patients were admitted at Inkosi Albert Luthuli. We will also take time to give you a breakdown in terms of our healthcare facilities, ICU patients, and the proportion, those ventilated, and the percentage. In terms of persons under investigation, KwaZulu-Natal has an increase in number of persons under investigation admitted in public facilities. Some of the admitted persons under investigation occupied ICU beds, and that was at 2%, which is in terms of specific numbers, 22. Of those admitted in ICU, 45 were ventilated, and there is a breakdown that will be provided. In terms of infected healthcare workers, a total of 2,167 healthcare workers have been infected with COVID-19 since the beginning of this pandemic. More than half of those infected are nurses. Of the total infected, a percentage succumbed to death, and the number of those who have succumbed to death or we have lost them is 16. In terms of comorbidities, the most common recorded comorbidities amongst the deceased include hypertension, which is at 29%, and diabetes at 28%. The proportion of HIV infected is at 6% so far. In terms of community and facility screening and testing, a total number of 9,432,258 cases were screened in the community and facilities from 8 April until the 24th of July. Those covered 82% of the provincial population. With regard to the impact of the enhanced level 3 by the President, since the implementation of the latest lockdown restriction, we have seen a significant reduction in all categories of community-reported crimes when compared with the same period last year. For the period 12 to 25 July 2020, we have noted a 24.2% decrease in all conduct crimes, which include murders, attempted murders, assault, sexual offenses, and robberies. During the same period, we also have noted a 28.8% reduction in property crimes, which include burglaries, theft of motor vehicles, and others. Community-reported crimes also decreased by 22.6% over this period. Coupled with the implementation of these lockdown regulations, increased police operations have resulted in a large number of arrests for various crimes, including smuggling illicit cigarettes. Criminals have come up with very innovative ways of smuggling cigarettes. However, police officers working at a number of roadblocks across the province have arrested them and seized massive quantities of counterfeit cigarettes. We hope that this is a wake-up call for those that may think that they can use this period to commit crime in KwaZulu-Natal. Well, on a positive note, let us wish His Majesty the King a happy birthday. And last but not least, we wish to close off this presentation by wishing His Majesty the King, our treasured father and leader, uBhejane Phumesiqiwini Silo Samabandla onke, a happy 72nd birthday, which he will celebrate tomorrow. Our province is blessed and highly favored to have a unique leader such as Isilo Samabandla, who is one of the world's longest reigning monarchies. Through the years, His Majesty has consistently led us with wisdom and bold honesty. He has been there providing a beacon of hope during the dark days of apartheid. He was there during our transition from apartheid to democracy. At the height of the HIV and AIDS pandemic, he never shied away from providing leadership and speaking out openly against the disease when it was ravaging our communities, even when it affected his own family. Even as we navigate our way out of these uncharted waters of COVID-19, which have also affected the royal household, His Majesty is there providing much needed guidance, even when his family once again get affected. We wish him well. We pray that the Almighty continue to guide him so that he can continue to be with us for many, many more years to come. In conclusion, we wish to express our deep concern about the situation that has developed in Umsunduze municipality, where a smoke from the burning dam site polluted the entire area and is posing a health risk to the residents of that municipality. In this period, when we are dealing with a crisis like COVID-19, we do not want our people to get sick and occupy hospital beds due to avoidable causes of illnesses. This is a matter we are attending with a deeper sense of urgency. We believe that the time has come for us to deal with this matter and try to employ a permanent solution. We have assigned the Department of Economic Development, Tourism and Environmental Affairs under MEC Dube Ncube, as well as MEC for Kokta, MEC Shomuka, and MEC Champion, MEC Ravi Pillay, to work on this crisis with the municipality. This work should include assessing the capacity of the municipality to cope with this function of waste management and, if need be, explore options following law, including whether this function can be assumed by another layer of government and be handed over when it is resolved, as contemplated in Section 139, 1B of the Constitution. There is an urgent need to find a long-term solution to this challenge using the resources available within the municipality, or trying to see whether another sphere of government must come in and resolve the matter once and for all. The lives of our people are a priority, and as government, we hear their voices. We will receive a report from the departments that have been assigned on the matter because it is wish to thank you, colleagues, once again for being with us today.
Thank you very much. Premier, we'll quickly move into taking the questions, starting with the first and here, ENCA, Sheila. Let's start with that first round and then we take also the colleagues that will be asking online.
There's just one question from me now. With regard to the updates when I have Dr. Pixley Cyber Hospital, how far is it and when can we expect it to be up and running?
Okay, the next colleague.
I'd like to find out, with the total number of healthcare workers who are infected sitting at 42,000, have you been able to ascertain as to what is the cause of that? Because you are aware that they do have sufficient PPE and there are safety protocols that have to be adhered to within the hospitals. So what is the cause behind it? And then also looking into the number of tests that have been conducted. I understand that KZN contributes to about between 7 and 10% of the cases that of the tests that have been done nationally. Are there plans to intensify testing? And my last question is around the fact that KZN is expected to be one of the highest in terms of the cases. Of the 16 or over 16,000 beds that we have, in a situation where we do become the epicenter, do we currently have enough beds to deal with those cases that may arise which need to be hospitalized?
Okay. In terms of Ilokuzane, my question is going to the MEC for Health. Njengamanje kunale simo sokuthi i-COVID-19 has reached the highest peak, especially here KwaZulu-Natal. And kunomuzwa lana endaweni eziyimtholampilo ngezwa ubungqongqoshe MEC uyakhuluma kakhulu ngebhedlela, but there's less that we hear about inkinga yasemtholampilo. Ama-clinics ayacomplaina ukuthi abasebenzi bakhona ingathi umnyango awubanakile. Kangangokuba kunama-clinic awu-2 eyasemlazi kwa-L kanye neyasenanda. La kutholakala khona ukuthi kunabantu abasebenzi aba-affected noma aba-infected nge-corona, kodwa bayaqhubeka basebenze kungavalwa. Enanda kuze kwaba khona nomunye oshonayo, kodwa still baqhubeka basebenza kwangavalwa nje kwalokhu kusetshenzisiwe. And abaphathi bakhona babukeka bengabona abantu abathanda ukulalela abasebenzi. So abasebenzi bayakhala kakhulu ngokuthi umnyango ungathi wona-ke awubanakanga. And then esibili umbuzo wami uyalapha kuNdunankulu ukuthi ukhuluma ngey'ndawo lapho isolate khona noma ku-quarantine khona amabhilidi kanye namahhotela, ukuthi abantu ukuze bafike bakwazi ukuthi baye lapho kufuneka benze njani, bafonele inamba mhlambe lefonelwayo ukuze kube yona ebarifeyayo ukuthi baye lapho, njengoba uNdunankulu ekhuthaza ukuthi abantu kungcono baye endaweni efana nalezi kunokuthi bahlale emakhaya. Ngiyabonga.
Good afternoon, ladies and gentlemen. Good afternoon to the Premier, HOD, and to the colleagues. Let's appreciate the questions that have been raised. Mhlambe ngizoqala ngale yakho sisishila, because you are raising a point ebengifisa vele ukukhuluma ngayo earlier on. Le yokugcina yokuthi abantu mangabe befisa ukuba ukungazi self quarantine noma self isolate, befisa ukuthi bangene kuma facilities ethu benze njani. ikhona inamba ikakhulukazi eThekwini and sesithatha isinqumo sokuthi ama district onke awabe nenamba eCentral lapho abantu abazokwazi ukuthi bayifonele uma ngabe umuntu efisa ukuthi uhulumeni angenelele amsize. Before siqeda nje manje ngizobe sengiyibiza so that sikwazi ukuthi abantu bakithi balithole lelo thuba. I'm happy ukuthi you've raised it. Into eyenza ukuthi ngikujabulele lokho ingoba in the past 3 or 4 days umnyango wezempilo ubona ukuthi inamba zabantu abashonayo beshonele emakhaya ziyakhula kodwa abaningi abaningi kakhulu kodwa inamba yabantu abashonele ekhaya bengakaze beze emnyangweni wezempilo ibukeka sengathi yakhula. Bakhona abahamba bayobona odokotela ama-GPs odokotela abanye instead of ukuba testa noma ukuba refera emnyangweni wezempilo noma isibhedlela or clinic ukuthi abatestwe baba treat bese bethi abahambe bayohlala ekhaya. Uma sebehlele ekhaya beze self isolate or quarantine ba complicate abanye baze begcine beshonile only because abazange beze emnyangweni wezempilo. So ngalokho nathi siyayenza we are making a call right now ukuthi siyacela ukuthi oza ukuthi sibambisene nabo kakhulukazi ama clinicians uma ngabe bewabona ama patients bengakwa abazipresenta with flu like symptoms siyacela ukuthi ababa test kodwa uma bengakwazi ukuba test ababa refer emnyangweni wezempilo so that umuntu angagcina ehlele ekhaya isikhathi eside isidingo singekho azaluza impilo kanti besingakwazi ukuthi simsize uma ngabe ebekhona emnyangweni wethu wezempilo. So sinaleyo request esiyenzayo. Abanye abantu manje siyabona sibonile in the past week ukuthi khona abantu abashonayo abagcine beshona be ama PUIs. Ama PUIs is person under investigation okusho ukuthi umeshona ushona kungazange kube khona into esho ukuthi ngempela ube nayo iCovid-19 ngenxa yokuthi azange test. Kanti uma ngabe ebelitholile usizo besingakwazi ukuthi simteste simtreat. So abaningi ke sesibona inamba zabantu abashona besemakhaya bengakaze beteste yanda. Ingakho sicela ukuthi uma ngabe odokotela bengakwazi ukuba testa ababa refer emnyangweni wezempilo so that sizokwazi ukuthi sibateste. But sithathile ke nesinqumo no head of department ukuthi sizoqala sixoxisane nodokotela abanye ikakhulukazi la kwi-area yaseThekwini ngoba lapho sibona ukuthi kunenkinga khona. Sike saba nayo inkinga efanayo kwi-district yasothukela ngicabanga ukuthi about a month or so back i-district yahlangana nodokotela yaxoxa yalungiseka leyo nkinga. Last week ngachaza ukuthi nasekuqaleni kwe-pandemic sasinayo i-challenge ecishe ifane kwi-district yaseMgungundlovu sayilungisa nayo. So naseThekwini ke we hope ukuthi sizokwazi ukuthi sixoxe kahle nozakwethu sikwazi ukuthi siyilungise leyo. So sizoyikhipha ke inamba yokuthi uma ngabe umuntu efisa ukuthi a quarantine in our facility aphinde noma isolate kwi-facility yethu yiphi inamba bangayifonela then sikwazi ukuthi sibasize bakwazi ukuthi bayithole. Siyabonga kakhulu lo mbuzo because uyasiza ukuthi sikwazi ukuthi sinikeze information edingekayo in relation to ama clinics. Ngicabanga ukuthi umbuzo obuzayo is quite genuine. Akulona kodwa iqiniso entirely ukuthi onesi bethu abakuma clinics abanakiwe ngendlela yalabo abanakwe abaseyibhedlela. What we do onesi bethu bonke in each district but belong to a district manager or district manager whether basesibhedlela noma baseclinic. So uma ngabe kukhulunywa ngeavailability yePPE kukhulunywa ngokuthi staff singakanani kuphi into yonke leyo emanagwa endaweni eyodwa emanagwa ku level of district director. So onesi abasebenza ema-clinics siyabanika nabi iPPE eyanele kule level abasebenza kuyona senzela ukuthi sikwazi nabo ukuthi bazi protect. Enye into engicabanga ukuthi kufuna sikuchaza ukuthi siyayithatha serious ngempela lolu daba. Inhloko yomnyango wezempilo mhlambe in the past 2 weeks usevakashele more than 4 clinics in kwi-area yaseThekwini in particular ngoba bekukhona lawo ma concerns mhlambe ikhale sihlala siyithole ukuthi abantu abanakiwe ikakhulukazi in the area yaseNanda kunama clinics ayi-few lapho amakhulu obekubonakala sengathi kunenkinga in terms of management and the head of department yafike yangenelela. So sinakile kodwa ke lapha kunama challenges khona njengoba usubalile uthe eMlazi ngicabanga ukuthi uzosinika ama details naseNanda ukuthi yipi clinic usinika ama details so that we go in sibheke beyond just into broad sibuke ukuthi kahle hle ngempela ikhona yini inkinga yini ama challenges lapho okubonakala khona and this is what we have done previously lapho okubonakala khona ukuthi kukhona abantu noma kune infection rate e clinic enkulu siyaye uma ngabe isidingo sikhona siyaye siyivale leyo clinic for about 48 hours sizoyiklina siyilungise, but in the meantime ngesikhathi onesi bethu bethathiwe beye kwi-quarantine or kwi-isolation depending ukuthi balinda ama-results noma sebewatholile, kuba khona ama-teams esiwafakayo. You remember last week ngakhuluma ukuthi we've started ukwenza ama-mobile units azohambela ey'ndaweni so that kungagcini kuvalwe i-clinic altogether. Now uma ngabe siyivala i-clinic-ke siyayiletha i-mobile unit ukuthi mhlambe inama-mobile vans as well so that onesi bethu basebenzele kuwona. Ngizama ukukhombisa ukuthi sine-strategy esikhuluma ngey'bhedlela siphinde sibe ne-strategy esikhuluma ngama-clinic so that sikwazi uku-intervene nge-level appropriate at that particular time. Kodwa-ke lapho kunama-challenges khona sizangenelela. I don't think it is a big challenge, but kufuna sikucacise nakho the same way sasikucacisile ibhedlela ukuthi ngeke size sivale isibhedlela sonke isidingo singekho, naseklinika sivale iklinik yonke isidingo singekho. Siyenze assessment sibuka ukuthi infection ihambe yafikaphi and then sivale that area i-decontaminate. Angikunikeze isibonelo, sometimes you'll find ukuthi kukhona i-health worker infected, kodwa njengoba kade infected ibingekho emsebenzini for the past 3 days anyway or for the past 4 days. So uma ngabe ebeke wahlala ekhaya uqala ugula ehlele ekhaya wayesayatesta ama-results aba positive for a particular duration, uma ngabe ebengazange abe khona for that period, asikho isidingo sokuvala iklinik ukuthi kuvalwe iklinik yonke. Sitesta labo akade sebenze nabe eduze, in particular the day eqeda ukuhamba sikline lapha akade sebenze khona while the other side of iklinik iqhubeka ukusebenza. I'm just explaining i-level infection and the research that we do before we close the facility. So that is the response that we have in relation to that SIS-Shield. The first question that was asked was in relation to an update on Pixley Isagaseme Hospital. When are we going to be able to utilize it? We had a last meeting with the contractors about 2 days ago, and because we were asking exactly that particular question. And in terms of the work that is being done by the contractors on site, it's completed. There is just one particular element that is speaking to the fire certificate that we must receive as a Department of Health. Now that is a process that needs to be followed between ourselves and the municipality, and as of tomorrow we are engaging on that. We are hoping that by the end of July the facility will be open and we'll be able to utilize it, or early August. But at this point we have not run out of beds to a point that we are so much under pressure that we must really get that facility up and running. However, because it's one of the facilities that we've counted in the 16,000 beds that we have, we are working very hard in ensuring that that facility is up and running. Okay, I've received the call number, call center number in relation to abantu mangabe befisa ukuthi sibasize. Inumber yethu is 033-846-6000. 033-846-6000. So that is the number ke abantu abangayifonela, not just eThekwini kuphela, abantu abangayifonela all over the province ngoba is a head office eMgungundlovu, and we can then assist in relation to that. In relation to the infection of health workers, have we found an issue, or have we found what is the genesis of the infections? We are conducting different researches in different facilities, and like we said, we know our approach is really not to point hands, but our approach is to try and correct areas where there are areas that needs to be corrected, and we, in different facilities, we have found different reasons that are a reason for infection. In other areas, we have found that it's the inappropriate or improper usage of PPE. In other areas, it's in other facilities, we found that it's sometimes not the issuing of PPE on time to the health worker. So it's different areas. However, we agreed that particularly with the organized labor, we agreed that we needed to focus very much on Inkosi Albert Luthuli infections. And we have done that, and with the assistance of the University of KwaZulu-Natal, there is a team that is there and has been there for the past week, and we are hoping by beginning of this week we are going to get a report, a proper report from them that is going to tell us exactly what is the issue. Because also remember, whatever work that we are doing now, it's not just work that we will be preparing for e-Albert, but it's work that will be, the results and the outcome will be implemented all over the province. So we are waiting for that report that we are going to get pretty soon, and it will be able to give us a proper direction. Are we hoping to intensify testing? We believe that we are testing enough as it is, because of like the Premier was indicating, of our of the tests that we are putting out, it's only a particular percentage that comes out as positivity. Now, unless we had a positivity rate that was very, very high, it would then have meant we needed to increase and intensify our testing. But for now, we believe that we are testing enough, because it is in line with the protocols and the guidelines that have been given to us, but by both NICD and the National Health Laboratory. Of the 16,000 beds, are they enough? Yes, we believe right for now they are enough. You would remember, or you would know, about a month or so back, Premier had consistently been announcing that we have 7,000 beds in the province, and you are now clearly able to see that we have improved from the 7,000 beds to 16,000 beds as we speak. By the way, of the 16,000 beds, we've not even counted the other beds that we are currently working on. We've got 3 temporary sites that we are looking at in 3 different districts, which is Herikwala district, Ugu district, and Utugela district. Now, those sites already we have not included in the 16,000, because these are sites that will take about 10 to 15 days to put up, and as soon as we are sure that they are ready for us to utilize, we'll be adding them. I'm saying this because I want to indicate that for now, we believe the 16,000 is enough, but we are not sitting at home and just saying, we're not being complacent. We are saying we've got 16,000, we think it's enough, but we are working to get more beds. So as we move on, we'll be able to indicate. I must also indicate that we have been for a while negotiating with the private sector as well, in terms of whether we'll be able to utilize the beds that they have. The 16,000 that we have and we have calculated here does not speak to the beds that are in the private sector. It's just the beds that we have in the public sector. The challenge that we have with the private sector, or with confirming the beds that we have in the private sector, is that some of them we will have to pay for as government, and with the financial constraints that we have, we need to be able to work out properly whether we are able to afford those beds, or whether we need to look at an alternative arrangement for us to be able to add the beds. So for now, we believe that the beds are sufficient, but we are working on adding on the beds that we have. I think Babu, Program Director, those are the questions that I had.
Thank you very much, Honorable MC. I think most of our colleagues also that are watching online are indicating to be covered at this stage. The request is that they be arrived in Zulu.
Okay, for the Premier. All right. Sorry.
Now, thanks, Mr. Mabaso and MEC Masmelane Zulu. We would like to take this opportunity. Sifisa ukuthatha leli thuba sibingelele sibonge ukukhona boza kwethu bonke abasuka emkhakheni ehlukahlukene yezezindaba. Sibonga kakhulu ukuthi selokheni nathi ekutheni sikwazi ukudila nokuthi silokhe sinikezela ulwazi kubantu bakithi bakwaZulu-Natal nasezweni lonke ngesimo salolu bhubhane esibhekene naso. Siyafisa ukuqala ngokudlulisa amazwi okufisela bonkoza kwethu labantu base-South Africa bebonke ukululama okusheshayo, njengoba sizwile ukuthi ungqongqoshe wezokumbiwa phansi ubaba uGwede Mantashe nomama uNolwandle Mantashe batheste positive, ubaba uNxisi ngonjalo no minister uPatel. Sithi bonke mabarecover ngokusheshsha. Nabantu nje bakwaZulu-Natal nabase South Africa ababanjwe lesi sifo sibafisela ukurecover okuphuthumayo. Siyafisa ukugcizelela ukuthi istorm lesebesilokhe sithi siyeza sesifikile, okusho ukuthi sesisesimeni la esithi ubucayi bukuyo yonke indawo, isimo simazonzwane isibambene. Masisho ukuthi esikhathini esikuso sesiqalile siyabona ukuthi i-COVID-19 akuyona into ekude omuntu nomuntu ayibukela kude, kodwa manje sesiyazi futhi sesibonile abahlobo bethu, abangani bethu, omakhelwane, abafowethu nobaba, odadewethu nomama bethu bekonfenywa ukuthi sebe positive. Kuba buhlungu ukubona abantu begula kabuhlungu bephethwe lesifo, abanye baze bedlule emhlabeni. Ayikho indlela yokuyivikela ekhona ngaphandle kokulandela lemgomo ebekiwe. Lemgomo ithi masiwashe izandla ngamanzi nensipho isikhathi nesikhathi, noma sisebenzisa ama sanitizer, sigqoke ama mask, senze sure ukuthi siyaqhelelana siba nebanga uma seyindaweni la zomphakathi. Siyafisa futhi ukunikezela isiqiniso elithi ayikho njengamanje into eyisolution kulesi sifo eyisixazululo ngaphandle kokulandela yonke imigomo ebekiwe. Okusikhathaza kakhulu kulesi sikhathi ukuthi kuya ngokubonakala abantu bengayilandeli imigomo, isikakhulukazi uma kuza ekutheni kuba khona ukufihlwa imingcwabo, kube khona imicimbi la abantu bebonakala khona babe baningi, babe ngaphezulu kwesibalo lesi esu-50 esibekiwe, bengayilandeli imigomo ye-social distancing. Kwezinye indawo uthola ukuthi even ama-mask akafakwa nhlobo. Konke lokhu kubeka impilo zethu nempilo zabathandiweyo bethu ebucayini. Siyafisa ukugcizelela ukuthi wonke umuntu makalandele imigomo ebekiwe ngendlela eyiyo. Kulesi sikhathi samanje ngiyafisa ukuthi sicele isikakhulukazi kubaholi bonke, especially abalapha eindaweni kuma ward esivela kuwo, sicele kubaholi abaholi, amakhosi nezinduna, sicele kumakhansela, abezenkolo nawo wonke amakomiti ama-ward ukuthi ake siqinisekise ukuthi siyaqinisa isandla ekutheni imigomo ilandelwe. Ngaba kunemingcwabo noma imicimbi ethize, asiqinise isandla ukuthi imigomo ilandelwe ngokuyikho. Siyafuna futhi unxusa abantu bakithi ngoba enye yezinto esibona isilimaza ukuthi abantu bakithi bafika ezibhedlela kade leli gciwane lingaphakathi libadla. Umuntu aqale eyitshena ukuthi uzosebenzisa izinto zakhe ngaba ezesintu, afike esibhedlela sekulate. Siyacela abantu bakithi baqonde kungcono ukuzame ukubalansisa kokubili, asikubukeli phansi ukulashwa ngokwesintu, kodwa sibalansise kokubili ukuze ungafiki esibhedlela sekudlule isikhathi. Siyazi futhi ukuthi sekunomuzwa othi kwabanye abantu ibhedlela azikho safe, umuye esibhedlela awubuyi. Siyafuna ukuthi sigcizelele ukuthi abasebenzi bezempilo basebenza ngokuyimisela, ingakho abaningi abantu bephuma bephilile ezibhedlela kuze kube manje i-death rate nakubinyuka, kodwa isengaphansi iseku-1% at least. Siyacela ukuthi abantu bayisebenzise izibhedlela. Okunye kunokuthi abantu bathi bazoyiquarantina emakhaya, lokhu okwenza ukuthi umuntu athi uyoyiquarantina ekhaya aqhubeke ahlale nezihlobo nomndeni kuze kufike nabangani kwezinye izikhathi utholeke ukuthi ukutheleleka kuyadlula lolu bhubhane luyaqhubeka luyaphambili. Sithi kukho konke lokho sicela abantu bazi ukuthi kubalekile ukuthi uma usalindile uquarantined noma usuzwile ukuthi uinfected uya kwi-self isolation, yiya esikhungweni sezempilo la uzonikezelwa khona umbhede ukwazi ukuthi unikezelwe isupport ngendlela eyiyo. Indawo zonke zaKwaZulu-Natal kumanje singasho ukuthi zingama hotspots, akho ne district eyodwa. Onke ama district KwaZulu-Natal anabantu aba infected. Ayikho neyodwa district othola ukuthi akekho umuntu osedlulile emhlabeni ngenxa yalesifo. Onke ama district anabantu ababalwayo kuthiwa sebedlule emhlabeni ngenxa yalesimo. Iward neward uthola ukuthi kunabantu aba-infected. Ngesonto sekuripothwa ngesonto elilodwa ama cases abe ngaphezulu kuka-3,000, okuvezayo ukuthi izinga lokunyuka kwama cases selilukhulu ngokuphindaphindekile lapha KwaZulu-Natal. Kanti siyabona futhi ukuthi njengoba silokho esisho ukuthi i-district ehamba phambili bekuyiTheku kulandela iLembe, manje uMgungundlovu neKing Cetshwayo namaJuba sebedlule ngisho iLembe, sekuyiTheku uMgungundlovu abanezinamba eziningi kulandela iKing Cetshwayo namaJuba la kubonakala khona ukuthi izinamba ziyazenyuka. And siyafisa ukuthi kulezi indawo nakuyo yonke KwaZulu-Natal abantu mabaqhubekele sizivikele kulesi sifo. Izinga lokutesta siyangafisa ukubonga ukuthi kumanje libonakala lihamba kahle. Abantu abathestwayo baya ngokuba baningi KwaZulu-Natal. Sesiteste abantu abangaphezulu kuka 9 million lapha KwaZulu-Natal, okungu 82% wabantu beprovince yonke yaKwaZulu-Natal. Siyafisa ukuthi sibonge ngoba lokhu kusho ukuthi kuyabonakala umsebenzi womnyango wezempilo ulokhe utesta uscreena abantu, and njengoba sebela ku 9 million kusho ukuthi abantu esesibascreenile sabathesta inamba iya inyuka. Kodwa futhi noma usutestile ziphathe ngendlela eyiyo, kungasho ukuthi phinda uziphathe noma kanjani ungaze ubuye utheleleke. Ngiyafisa ukuthi sibonge uhulumeni kazwelonke ngokuthi since kufakwe i-restriction i-lockdown ku level 3 kwathi uqiniswa kwavala ukuphuzo nokunye, siyabona ukuthi ubugebengu buya ngokwehla. Siyabona ubugebengu ukuthi contact crime nje yehle kakhulu yaba ku 24%, kanti ngonyaka odlule yayi ku 28.8%. Nobunye ubugebengu obuhlale busihlupha behle kakhulu since kuvalwe kwaba nale lockdown eminyezelwe umongameli. Ngiyafisa ukuthatha leli thuba ukuthi sifisele uBhejane ephuma esiqiwini isilo samabandlonke usuku oluhle lokuzalwa kusasa. Siyabonga ukuthi KwaZulu-Natal sibusisiwe ngokuba nomholi ofana nesilo samabandla, ongomunye wombaholi emhlabeni bonke osebese esihlalweni sobukhosi iminyaka eminingi. Sithi siyabonga ukuthi ubuhlakani bakhe nobuholo lwakhe njalo liyasilekelela lapha KwaZulu-Natal. Manqinisekise abantu bakosemsunduze namaphethelo ukuthi udaba lwale ntuthu eshayo iphuma kwisite dumping site siyalandelela ngokusheshsha. Sesithumele ithimba elino MEC uDube Ncube waka Economic Development, Tourism, Environmental Affairs, MEC waka Khokta uSipho Hlumuka no MEC uPhiley uRavi Philey njengo champion wakuleya district ukuthi basebenzisane nomasipala ukubheka ukuthi lolu daba luya addresseka ngendlela. Sibheke necapacity kamasipala ukuthi iyakwazi yini ukumelana nezidingo especially when it comes kwinto zokumanage i-waste. Siyafisa ukuthi ngalesi sikhathi sobunzima be-COVID-19 singabuye sibone edeka ezinye izifo ebeyingagwemeka. Yingakho sesithumelele lithimba ukuthi lisilekelele ukudila nale nkinga yasemsunduze ngokusheshsha. Siyabonga.
Thank you very much,
All right, that is an update from the KZN Command Council. Of course, we also heard from Health MEC Nomakuku Simelane Zulu. The Premier of KZN, Sitlisi Galala, giving an update saying that all areas are in fact affected and that the impact is in each district in KZN. He also went from area to area giving an update on new cases, deaths and recoveries. Very important to note that 2,167 healthcare workers have been infected in the province. He also made mention of the fact that in terms of laboratory tests and status, that the province is the third highest laboratory testing in the country. So those are some of the things that were raised by the Premier in his briefing. Also mentioning some of those areas affected, including Umlazi, KwaMashu, Phoenix, Chatsworth, Newtown. Those are some of the areas badly affected by coronavirus, and that the reminder that the coronavirus is indeed close to us at this point. He gave an update on beds and facilities that are available to house those that are affected and infected by COVID-19. All right, so that's the briefing then by KZN Command Council on their response to the coronavirus. Of course, in the previous hour, we gave you the press briefing by EFF leader Julius Malema celebrating the party's 7th birthday. He says that the party